Okay. Thanks for inviting me, Rob, and hello to everybody. When Rob asked me to give a talk, he said that I could talk about my passion. And my passion, as you might have noticed, has been an ongoing passion, and it's that of medical English. So I'm going to talk to you about medical English. I've been teaching and teacher training and coursebook writing in this field for about 20 years now. And I currently teach doctors who are looking to work in the UK. So just to give a bit of context to this field, it's quite a vast field, and where a lot of learners are using English to communicate with patients. There are many, many more of them who are using English to engage in research, to promote their research through journal articles and presentations. And increasingly more and more, as the previous speaker mentioned as well, medicine is being taught, and nursing even, is being taught through the medium of English. So English is being used in medical faculties across the world. There are another couple of areas that are interesting as well, where English is used as a lingua franca, and that is medical tourism. Not something that I know an awful lot about, but it is another area. The real game changer recently has been the OET, or Occupational English Test, which has meant that there are more and more opportunities for people to teach medical English. So the idea today is to give you a few tips and hints if you've never taught medical English. And I'm doing it from my perspective. I teach patient communication skills, and I think I started to understand about the importance of effective patient communication skills when I was quite young, although I probably didn't realize it at the time. I had a doctor when I was about 8 or 9 who used to shout at her patients. And I always felt that a little bit undignified, as everybody in the waiting room could hear what the problems were for each and every patient going through. So I probably started to understand a little bit about patient communication skills from that point on. Later on in my teens, I had a wonderful doctor who always seemed to remember something about me. He always remembered the fact that I was studying French and how much I was fascinated with Paris and all things French. And it already started to feel a bit more of a personal experience, or personalized experience, if you like. When I got to France, I had various experiences with different doctors, mainly positive, but one time I was bitten quite severely by my mother's dog, and I ended up in hospital in Paris. I'm returning to Paris, and the infection had been in my ear, and it was, I'd bitten my ear and I got some kind of infection. It was getting worse and worse. When I arrived at the hospital, I was told quite simply by this doctor, best case scenario, you'll be left with a cauliflower ear. Worst case, you'll lose your ear. So from that point, I started to think, okay, that's probably not the best way to deliver any kind of bad news. There's something slightly amiss with the way this doctor is communicating with me. So from a personal experience, I've had a lot of examples of both good and not so good patient communication skills. Of course, we need to learn from experts, and two of the experts that have really influenced me has been these two guys here, William Osler and Jonathan Silverman. Now, William Osler, clearly from the dates, is no longer with us, but one of his famous quotes is, "Medicine is learnt by the bedside and not in the classroom." And that was a real light bulb moment for me. And I really started to understand that the principles behind patient communication skills that I was teaching with my students, what was important was the patient, and not necessarily all the medical references that that they would have been used in their universities. Medical communication skills was a lot more about dealing with the person that you have in front of you. Indeed, Jonathan Silverman, and if I was to recommend one title for new medical English trainers, it's this one, and it's the Calgary-Cambridge Observation Guide. And Jonathan Silverman gives us a framework around which we can really develop our patient communication skills lessons. And this framework takes you step by step through a patient consultation and is really transferable to the English language classroom, and it's something that I have based an awful lot of my materials around, and it's actually the basis for effective communication skills and also the OET that I mentioned earlier. Now, understanding the patient and understanding a patient-centered approach is really the key behind effective patient communication skills. And this is something that your learners need to know about from day one. It could be you have learners who have not necessarily studied medicine in quite the same way as doctors trained here, for example, in the UK, and they haven't necessarily followed a patient-centered approach. Now, what is a patient-centered approach? Well, it's a holistic approach to patient care, and it's one that involves the patient as a whole. I've got two patients here, John and Henry. Now, Henry, amazingly enough, is 87 years old and swims 40 lengths a day. Now, understanding that patient as a whole will ensure that his treatment and the care that he receives is much more personalized to him. John is illiterate, and so his access to patient care may be slightly different. So his treatment and the way in which the doctor engages with him will need to be a little bit different, again, from other patients. Something that's important in all communication skills is culture. And when you're training people to come and work in the UK, for example, they need to understand something about our culture. Now, I often show this picture with my doctors. They just arrived in the UK, and they need to understand that our culture is around the issue of alcohol may be quite different to the countries in which they were trained and where they are used to practicing. So this picture generally creates a bit of a shock. Lexis is always a fun thing to deal with in medical English, and you can have a lot of fun with it. What's important is to ensure that your students are able to understand the patient as clearly as possible. One of the things is to get them to avoid using medical jargon, which they're so fond of using, and to explain things in a patient-friendly way. It's also useful for them to know something about the local colloquialisms around different aspects of health and, in fact, dying in this case. So, popped his clogs, kicked the bucket, pushing up daisies. This item is generally known as a stool, but in medical English, there is another word, stool, that has a different meaning. So, you know, you can have a lot of fun with trying to get the patients to explain the different meanings of a stool. I didn't give a picture of the other type of stool. I thought I'd let you imagine that one instead. Obviously, the internet has given us lots of openings as far as medical English are concerned, and we're able to access authentic examples of expert care. And this is my favourite doctor of the moment. His name is Mark, who appeared on the 24 Hours in A&E on Channel 4. And he just epitomises, for me, the perfect doctor in terms of his patient communication skills. You may come across some skeptics, fewer now than when I started training in medical communication skills about 20 years ago. 20 years ago, you could be sure that doctors and medical students would be sort of a little bit skeptical as to what an English language teacher could bring to the party. Today, it's very clear, and medical communication skills is being taught in a lot of overseas universities these days. But if necessary, you need to stand your ground. And so the idea that communication is a personality trait, either you have it or you don't, is not at all correct, and something that you could rebut with your students or anybody who is skeptical is the following. Communication is a series of learned skills, not a personality trait. Anyone can learn who wants to. And indeed, all the documentation, all the evidence shows that good and effective patient communication skills have a lot of benefits, and some of them are outlined here, including patient satisfaction, and most importantly, obviously, an accurate diagnosis. So, just to end with a few pieces of advice from some of my colleagues, because we're always learning, and if you're new to medical English training, obviously it's good to be able to learn from other English language trainers or English for medical purposes trainers. So Rebecca from the OET Cambridge group reminds us that we need to respect that there are always two experts in the room. One is yourself, obviously, as expert in communications, and the other is the healthcare professional who is an expert of their particular field. Buying a reference book may help you to have a basic understanding of anatomy and physiology, according to Pascaline from the Sorbonne University. Using online health information, which is specific for patients. There's an awful lot of that available that will help you train your doctors, train your healthcare professionals to give more patient-friendly information. And that comes from Virginia. And last but not least, Dr. John Skelton from Birmingham University. The idea of role play is essential in healthcare communications. And but as a trainer, make sure you do it for real, take it seriously. This is a way to allow them to practice before they are in front of a patient. And so getting them to practice without harming a real patient. Okay, thank you very much.
Great. That was